Welcome to Section 1 of Public Health Sciences. In this video, we'll discuss ethical principles that you'll be tested on and that are important to consider when making tough decisions as a physician. Let's get started. Here's an overview slide of what we'll be discussing. Let's begin by discussing autonomy. Autonomy is the capacity to make an informed, uncoerced decision. There are two important factors related to this responsibility. First, it's important to inform and educate the patient to help them make a good decision. This is often referred to as informed consent, which we'll discuss in a later lecture. And second, after a patient has been properly informed, we must honor their decisions. While this principle exists in every culture, the United States places a particular emphasis on individual liberty. This often translates to this principle taking precedence in medical decision-making, even when it conflicts with other principles. For example, a patient has the right to refuse a life-saving procedure even if the physician strongly believes that it's in the best interest of the patient to undergo the procedure. Okay, now that we've covered autonomy, let's move on to beneficence. Beneficence is pretty simple and essentially boils down to acting in the patient's best interest. This can sometimes conflict with a patient's right to autonomy, as a patient may refuse a life-saving treatment. You may also run into conflicts with the greater societal good, such as quarantining a patient. Which principle takes precedence is generally decided on a case-by-case basis, and we'll be doing some practice questions to help with this. The next principle is non-maleficence. This is a pretty simple principle and can be summarized in the words, do no harm. While this is easy to understand, it can be hard to put into practice, as patients often undergo procedures that may cause them harm but have large potential benefits. Therefore, this principle must be balanced with beneficence, knowing that patients must occasionally undergo short-term harm in exchange for a long-term benefit. Okay, next we'll be discussing justice. Justice is a simple concept to understand but can be tricky to practice in the real world. Justice is simply defined as treating everyone fairly and equitably. Ideally, we as physicians would be able to treat everyone the exact same in accordance with this concept. However, practical considerations, such as cost, ability to pay, and availability of resources, all tend to limit the ability to employ this principle. Okay, before we move on, let's do a quick practice question to help solidify some of these concepts. A 63-year-old man with a history of smoking and coronary bypass surgery presents to your office for evaluation of abdominal pain. He states that he has been experiencing intense epigastric pain after eating for the past several months and that it has begun affecting his ability to eat. He thinks he has lost several pounds as a result. You suggest that the patient will need an upper endoscopy to evaluate for stomach ulcers, describing the risks and benefits of this procedure. He refuses, stating that he hates the idea of you sticking something down my throat. He asks for a medication to help ease the pain. Which ethical principle would you be honoring by prescribing medication without performing an endoscopy? Which might you be violating? Okay, in this question, you are presented with a patient with abdominal pain, possibly related to stomach ulcers, who refuses to undergo upper endoscopy for evaluation. He requests medication for his pain, going against your medical advice to undergo further evaluation. The question then essentially asks what the ethical implications of honoring this patient's decision would be. Clearly, by honoring his request, you would be respecting the ethical principle of autonomy. The procedure has been explained and the patient is refused. Therefore, you should not do the procedure. Prescribing medication without having a clear diagnosis, however, is a little more complicated. While this might respect the patient's autonomy, you might be violating the principle of non-maleficence, because you may be harming the patient by prescribing the wrong medication or not conducting a thorough evaluation. So you may be violating the principle of non-maleficence. Okay, the next concept we'll be discussing is medication use. There are three main situations in which medication use will be tested: unnecessary antibiotic use, opioids, and non-adherence. Let's discuss unnecessary antibiotics first. With this topic, one common way you might be tested in a question stem is with a patient who is insistent that he or she be prescribed antibiotics despite having no evidence of bacterial infection. For this patient, a good general approach is to explain that antibiotics will not help his or her condition and ask for more information using open-ended questions. Non-maleficence is an important concept to keep in mind with this issue. Antibiotics are not a benign treatment. They have side effects, such as C. diff infection, allergic reactions, or other potential side effects. Overuse of antibiotics also leads to antibiotic resistance in the general population by selecting for more resistant bacteria that can go on to infect other patients. So when prescribing antibiotics, we must ask ourselves as physicians, will this drug harm the patient? Hence, non-maleficence. With regard to opioid use, there are a few scenarios that you'll likely see on your board exams. The first is the opioid addict. This patient will often present in the emergency department with a minor complaint and request opioids for pain. The general approach to this patient is to offer other alternatives and discuss treatment for their substance use disorder, but be firm on not prescribing additional opioids to them. It's important to recognize that even patients who abuse opioid medications can and should still be given opioid medication if their injuries are serious and their pain is severe. The next scenario to consider is the terminally ill patient. These patients should be given enough opioids to ensure their comfort. There is no consideration of addiction or abuse with the terminal patient, as the benefits of treating their pain far outweigh any risks posed by addiction or abuse. Finally, it's good to bear in mind that although there are risks involved with opioid use, they are a useful medication for pain control and can be safely prescribed to patients after a variety of procedures or injuries for a few days. Evidence shows that the vast majority of people can safely take opioids for up to 5 days, so don't hesitate to use them if it's warranted, as there is a low risk of addiction for short-term use. However, lower risk alternatives, such as NSAIDs, are generally preferred if patients don't have any contraindications. The final issue surrounding medication is non-adherence. Non-adherence to medication can be a major problem for patients for a variety of reasons. The general approach to this patient is to ask more questions to find out the underlying cause of their non-adherence. They should be coerced or referred to another physician. Once the cause has been identified, you should provide clear instructions and attempt to find resources that will attempt the patient to adhere to the medication regimen, such as involving family or home health. Finally, it's important to remember the principle of autonomy and recognize that you can only do so much. The patient is ultimately responsible for making his or her own healthcare decisions. Okay, the last concept we'll be discussing is gifts. Patients offer gifts to physicians for many reasons. Remember that you don't have to necessarily refuse all gifts. It can be okay in some cases. Some gifts are offered as an expression of gratitude or a reflection of the patient's cultural tradition. Accepting gifts offered for these reasons can enhance the patient-physician relationship, while declining them may offend the patient. However, you should never accept a gift given with the expectation of something in return, such as preferential treatment. Expensive gifts should not be accepted because they may put financial strain on the patient and may impose a feeling of obligation for the physician. As an alternative, a donation to charity could be considered as an ethical alternative to a personal gift. Okay, now that we've covered all of the material in this lecture, let's do another practice question. A patient presents to your office for follow-up 1 month after a successful knee replacement surgery you performed for her. Her vitals are normal, and her knee appears to be healing appropriately. She thanks you profusely and presents you with a beautiful hand-woven scarf that she states she has been working on every day for the past month. She also knows of your love of basketball and offers you 2 courtside tickets to an upcoming NBA game this weekend. What should you do? A. Accept the gifts and thank your patient for her generosity. B. Decline the gifts because they are too valuable and suggest that the patient could donate to charity on your behalf instead. C. Ask the patient why she feels it is necessary to give you such luxurious gifts. Or D. Accept the scarf but decline the basketball tickets. Okay, in this question, you are presented with a grateful patient who offers both a hand-woven scarf and tickets to an NBA basketball game. As we previously stated, some gifts are okay for a physician to accept. In this case, the woven scarf represents a large time investment by the patient, but is not an overly expensive gift. This is an example of a gift that would be acceptable as a way to enhance the physician-patient bond. However, courtside basketball tickets are usually very expensive and would likely be less appropriate for you to accept. So the correct answer is D. Accept the scarf, but decline the basketball tickets. A is incorrect because, as previously mentioned, courtside tickets to an NBA game constitute an expensive gift that might represent a financial burden on the patient or carry a sense of obligation for the physician. B is incorrect because it would be appropriate to accept the scarf. C is incorrect because questioning a patient's motives might be considered offensive and would not be appropriate in this situation. So again, the correct answer is D, and that concludes this section.